The College of Naturopathic Physicians of BC has recently approved the use of botulinum toxins, or Botox, and other dermal fillers for naturopaths in BC. The college admits there's no standard of practice for these treatments and they don't plan on incorporating one. Alberta's Dental Association and College has introduced a standard of practice, but the BC College says the cost of training would be prohibitive. That means naturopaths don't graduate with any training in the field. We're joined now by Doctors Warren and Jan Roberts. They co-founded the Pacific Training Institute for Facial Aesthetics in 2008, and they're here to share their concerns. Doctors, thanks for joining us.
Our pleasure.
Thank you for inviting us.
All right, so the obvious question first, why should people administering facial injectables have some sort of training?
It's to improve patient care and decrease negative side effects, and it increases the competency and proficiency of the injector.
What could go wrong? Worst case scenario.
We see cases where there's bruising, reports of bleeding afterwards, eye droops, eyebrow droops, different reactions, and imbalance from left and right, upper and lower. If a person hasn't taken the proper training.
Okay, and why the reluctance to agree that this is beneficial? Why this lack of certification, do you think?
Good question.
Yeah.
That's an excellent question.
Don't know the answer to that. You would think it would be a no-brainer.
Well, you mentioned the Alberta Dental Association of College, and they spent about 2 years getting the data and looking at what would create a good injector. And as a college, they wanted to look at it, and they did not want to deal with any complaints or negative side effects. And so they did a tiered and gated system, and it's worked really, really well. In the 2 years that they've had it instituted, they haven't had one complaint.
Okay, can you give us an idea of how prevalent injections like this are in British Columbia? How common is it for people to have this sort of procedure done? What I'm really asking is how many people would this affect conceivably?
A statistic would be hard to say, but a lot of people don't understand that the highest per capita incident for use of, say, botulinum toxin, Botox, is actually right here in the Greater Vancouver area.
Why is that, do you think?
Just, I guess, West Coast Canadians are, and what's important to them is their aesthetics. And then, of course, what's come up with Botox is that it can be used in huge areas of therapeutic use, which...
Right, yeah, that was my next question, actually. It's not strictly for vanity. What else can this be used for?
Well, we were originally taught in a very refined course in how to basically do the cosmetic uses. And coming from a dental perspective, we are used to taking a lot of photography. And so we were able to document and look at things, not just from a medical legal point of view, but a before and after point of view. And as we got to documenting with the photography, for example, we found that very few people marked or even did photographs. And as we marked the individual before we did the procedures, we were then able to compare the before and after results in 2 to 3 weeks. And then we were finding people coming back and saying, gee, I don't have any headaches, I don't have any migraines, my TMD is decreased, and go on. And so that's what we've been looking at.
All right, I have to ask, given your line of work, given that you are the co-founders of the Pacific Training Institute, would you benefit from this greatly if training was required, and how do you respond to that?
Well, our objective, or our Pacific Training, our goal is to be the best or the greatest training facility in facial rejuvenation. That's what we say, not just here in BC, but in the world. And we train people online now, except for the practical aspect. So, of course, we would gain by that. But it's not just that. You want people, when they come in, to be able to go back and enjoy things cosmetically and therapeutically with no fear, no hesitancy, knowing that their injector is going to get the outcome that they want.
Since these are often not medically necessary procedures, if people do become aware of the risks here, do you see a decrease in the amount of people seeking these services?
I don't think so. I think that the popularity of Botox is so widespread that I don't think you're going to see people stopping having injections. In fact, with the increase in the therapeutic uses that we're seeing and the benefits that patients find having had therapeutic treatment, I think there's probably going to be an increase in the use of it as this becomes wider known.
All right, that's an interesting way to look at it. Finally, the company, I understand the company that manufactures Botox has announced they're not going to sell their products to BC Naturopaths. What sort of issues will that lead to?
Well, I've heard the same, as that if they don't sell to them, they would have to find a different type of Botox, I presume, or I don't know what they're going to do.
Okay. All right, final thoughts here. Do you see this changing anytime soon? And what is this a matter of political pressure needs to be exerted here? Is it a matter of common sense? Is it something else? What needs to happen?
I think that the governing bodies of a number of these different colleges need to look at it a little more seriously. I think some of the people on the boards of various provincial bodies don't understand how it's used and what its potential is because they're not trained in it, and consequently they don't pay attention to it. And our goal is to try and provide the best training for as many practitioners as we can, whether they be medical practitioners or dental.
If these people don't understand what they're administering, why are they on these boards making decisions that affect a lot of people?
I guess Botox is somewhat new to the areas of maybe dentistry and some of the other boards, so they need to be educated in it.
Okay. We are out of time. I want to thank you for yours tonight.
Thank you.
Thank you very much.
All right, Drs. Warren and Jan Roberts.